Welcome back to the nationally syndicated Price of Business show, and we are coast to coast, really around the world. We're amazed. We get emails literally from all over the world from people who listen to us through all the various platforms out there to do it, as well as in our markets, 16 markets coast to coast. And I'm really I'm excited because I'm going to spend some time with John Kouten, who has been a long-term provider of great guest ideas with a company called JFK Communications, and the website is jfkhealth.com, always providing really timely guests that speak to a lot of the issues that we're all facing on a regular basis. And I size up the quality of a PR firm by the type of people they work with, and I've really been impressed with who he works with. John, welcome as always to the program, and we're going to talk today about crisis communication in the COVID-19 era, which I think is really timely. Kind of set the stage for us. I know you've been in this business for years. Why don't you talk a little bit about the background of the business and talk about how interesting things are now and how different things are. Glad to have you with us.
Thank you very much, Kevin. I really appreciate those kind words, and thanks to you and your listeners for having me this morning. And yeah, as you said, our business is life science, and it's been a very interesting time to be in service to the life science community. Our firm, has always been there to serve leaders in the pharmaceutical biotech sector, but it's been very interesting during this COVID-19 pandemic. And just to set the stage, it happened, Kevin, so fast. If you think about the first case, we're just about maybe 65, 70 days from 20 patients to 20 deaths to now over 90,000 deaths. So how this pandemic hit, it just hit so quickly. And our all leaders, whether it's a pharmaceutical company, a biotechnology company, or any leader, setting a positive tone is one of the critical aspects of crisis communication to instill trust and confidence in your constituents.
Yeah. And, 90,000 deaths, that's the United States. That's not even the world. It's even bigger worldwide. And, and I used to always wonder, because I was little when the Vietnam War was happening, but, I studied history, and I was wondering how we allowed something protract that long, killing 50,000. Well, 50,000 over 10 years is horrible, but nothing like what we're experiencing right now, where it's almost measured in days, not even years. And again, not at all to soften what happened with Vietnam War, but you can see how that could be tolerated when we're dealing with something like that, how easy it is to slip into something like that. And this is just really unfathomable. And I know you've been doing this for a long time, but have you experienced a time at all like this in your industry?
Kevin, I am very happy to say that no, I have not. And I'm hopeful that we will never again experience a crisis of this unprecedented scale. And the scale of this, what's so difficult for most communicators to deal with. It is just such a global scale. It touches everyone. And whether you're a public company or a private company, whether you're a small or a large or a startup, whether you're an academic or a nonprofit, I wrote a blog in early April about setting a positive tone, leadership communication under pressure, and I feel so badly for the leaders of any organization during this time, because the pressure to get the communication out and to get the communication right is vital. Because a crisis like this, it just generates so much uncertainty and so much fear. And so, yeah, I've never seen anything like it, Kevin. I've been around the block. I've worked for Johnson & Johnson, Bristol Myers Squibb, Sanofi, many big pharmaceutical companies. And, one of the axioms of business, and I'm sure your listeners will appreciate this, is if you're in business, you're going to experience issues. And the life science industry is no exception to that. But boy, oh boy, this takes it to a whole nother level. So my firm has been working very diligently to help these leaders during this pandemic.
So talk a little bit about crisis communication and what are the things you should avoid, and more importantly, what are some of the best practices?
Well, I always, I say it's a three-step process, not to make it too simple, but I always like to say take action, listen, and repeat. But to break it down from there, it's critical to have a plan. And if your listeners are sitting out there and they're like, oh my gosh, I don't have a plan, that's okay. You should work closely with a professional communicator to develop a plan. And then the best practice when faced with a crisis is speed, consistency, and honesty. If you can, start with those three core elements, then you're going to be ahead of the game, because speed is vital. Most CEOs and CFOs and C-suite executives, they're thinkers and they want to contemplate, but a best practice in a crisis is speed. And even if, I always like to tell my CEOs, even if you don't know the answer, in a crisis, it's okay to go out and set a positive tone that you're in charge. But if you don't answer, it's okay to say, geez, I don't know, but we're going to get the answer as soon as possible, especially when you have employees and you have customers and partners and shareholders, and then you have media calling. It's okay to say, I don't know, but we will find out. So speed is one of the most critical best practices.
Yeah, no question about it. John Kouten is my guest. He's with jfkhealth.com is his website. So talk about the various constituents that every business has to deal with. I think, of course, in terms of investors, of course, consumers of their products or services. Talk about the various constituents and kind of prioritize how a business owner or C-suite person should be looking at those.
For most crises, Kevin, it's the customer, and in many cases in the life science industry, it's the patient that we need to prioritize. If there's a crisis with a medication, we have to make sure that we get information out to patients. If it's a crisis with an industry that's going to impact your employees, these are the vital publics. And as a capitalist and as a person who knows a lot of the position that your listeners of the price of business come from, unfortunately, investors and shareholders are usually lower down the pecking order, but they also need to be told, what kind of information that they can expect. And I always tell my CEOs to tell the truth, and to tell the truth early and often, and that is amplified with bad news. In this environment where it's a 24-hour, 365 global news cycle, never have bad news break that you didn't know about. And if you have bad news, break it yourself. Get it out fast and early. And so if there has to be layoffs, it's better to get that information from the corporation than from the rumor mill. Yeah,
no question about it. Talk a little bit about how communicating with COVID-19 or during COVID-19 is different than other crises, besides the fact that it is profoundly different. Talk a little bit about the nuances involved.
Well, because it's a pandemic, and for the most part, responsible global markets are in a quarantine, we need to use technology. One of the best practices for most PR folks is to have a town hall, have focus groups, get everybody together. And today we have to use technology to get everybody together. And that poses challenges with different internet connections and availability of people to go on a Zoom call or go on a GoToMeeting. But it's different because of the fact that we're isolated. It's also different because it's so global. It's not segmented to market. It's not segmented to one industry. It's not segmented to one country. So it's a much larger kind of an issue, and it also encompasses the politics and the government. And so, my pharmaceutical leadership is looking to me to determine, what's the best mode of communication, when is the best time to communicate. And so, there's a lot of different considerations When you look at crises, there's a lot of crises that you can prepare for. I think a lot of CEOs are going to be forgiven if they weren't ready for this one.
Got about 30 seconds before I have to take the show back and wrap it up. Final thoughts, John, as we wrap it up.
Well, one final thought that I would say is that, from a public relations perspective, don't let COVID-19 limit the fact that this is an opportunity for companies to show their corporate leadership, to allow their corporate culture to shine and not be hidden behind quarantine. A lot of my best pharmaceutical and life science partners are using this COVID-19 crisis as an opportunity to be good corporate citizens. It's definitely not an opportunity to exploit. So I would say now's time to give back if you can.
Yeah. I'm Kevin Price. Thanks so much for being with us, John. Make sure you learn more about him and his company, which I think is a leader when it comes to helping those in the health science space, jfkhealth.com. Stay tuned for more after this on The Price of Business. Welcome back to The Price of Business. I am